What is hemophilia A and how is it inherited? Imagine a tiny part of your blood that acts like a super glue, helping your blood clot when you get a cut. Now, picture that this glue is missing or not working right in some people. That's what happens in hemophilia A. It is a genetic condition caused by a missing or defective factor VIII, which is a protein essential for blood clotting. Without enough factor VIII, blood takes longer to stop bleeding, which can lead to bruises, joint bleeding, or even serious internal bleeding after injuries. About 1/3 of cases happen without any family history. This means the condition can suddenly appear because of a new mutation in the gene responsible for making factor VIII. These mutations happen in the egg or sperm of a parent and are not inherited from previous generations. Hemophilia A follows an inheritance pattern called X-linked recessive. To understand this, think of the X and Y chromosomes. Females have two X chromosomes, while males have one X and one Y. The gene for factor VIII is on the X chromosome. Since males only have one X, if they inherit a mutated gene, they will have hemophilia A. That's why it is more common in males. Females need 2 copies of the mutated gene to have the condition, which is rare. Usually, females with one mutated gene are carriers. They might not have symptoms or could experience some bleeding issues like heavy periods or easy bruising. When a father has hemophilia A, he passes his X chromosome to all his daughters, making them carriers. But he passes his Y chromosome to his sons, so they do not inherit the condition from him. If a mother is a carrier, each child has a 50-50 chance of inheriting the mutated gene. Sons who inherit it will have hemophilia, while daughters will be carriers. If the mother has hemophilia herself, all her sons will have the condition, and her daughters will be carriers or possibly affected if they inherit the mutated gene from both parents. Female carriers are important to watch because some can have bleeding symptoms similar to mild hemophilia. They might experience heavy menstrual bleeding, easy bruising, or joint bleeds. About 30% of female carriers can have bleeding risks that are significant enough to need medical attention. Knowing how hemophilia A is inherited helps families plan and get tested. Genetic testing can identify carriers and affected individuals early. If someone in the family has hemophilia, relatives can learn their own risks and get proper care. This understanding helps doctors recommend the right treatments and support, making a big difference in managing the condition.